Hello, my name is Candy Berdan. I'll be discussing the next two slides of this presentation, non-maleficence as it relates to the healthcare professionals. What is harm? If we consult the dictionary, harm is defined as to damage or injure physically or mentally. In healthcare setting, harm is what exacerbates the status of a patient. To determine what causes harm to a patient in healthcare, it is not a simple arithmetic. It's not a simple 1 plus 1. This is because, unable to be cured and treated, patients may need to be inflicted with harm, with pain, with distress, with discomfort. We justify harm because there is a greater good. Case example of this double-sided effect theory of the natural law is a limb amputation. A limb amputation is required when a patient is suffering with severe injury, severe infection, burn, frostbite, and cancerous tumor. Harm in healthcare is doing something bad with no good effect. However, harm is not just a cause of physical harm. Harm can be inflicted by our leaders, by the managers of the organization, by not providing the tools and equipment they needed to care for patients, enough staffing to care for patients, therefore putting our patients at risk. Leaders that are not able to manage their finances that may result in a shutdown of a hospital. Another example is that an organization not following community recommendation and potentially harming the community and its people. We have different ways which harm can occur in healthcare. However, we have laws, state and federal laws. We have organizational policies and procedures, hospital policies and procedures that are in place to reduce the number of these gray areas. However, if healthcare professionals overlook or simply ignore these policies and procedures and commit to infliction of harm, then healthcare providers are found to be negligent. We have another stakeholder at the end of this spectrum, and this is the consumer of healthcare. This is our patients. This ties in to the patient's autonomy, our respect, when a patient needs to decide differently from what healthcare team recommends.